I'm about to reveal the specific hydration protocol that can help stabilize your blood sugar readings and support your metabolic health starting today. Many seniors unknowingly drink water in a way that dilutes essential digestive enzymes or fails to flush out excess glucose when it matters most, leading to erratic numbers. I will guide you through the exact timing, temperature, and mineral composition that supports your body's ability to handle sugar naturally. I remember a gentleman named Arthur, age 74, who came to my office frustrated because his morning blood sugar readings were consistently high despite his strict diet. He told me he was drinking plenty of fluids, but upon reviewing his daily log, I noticed he was consuming the majority of his water late in the evening and almost none during the morning hours. This pattern was not only disrupting his sleep with frequent bathroom trips, but it also meant his body was starting the day in a dehydrated state, which concentrated his blood sugar levels significantly. By adjusting when he drank rather than just how much, we saw his fasting numbers improve within a week without changing his medication. It is common for seniors to lose the sensation of thirst, leading to a chronic, low-level dehydration that doctors might overlook, yet it quietly wreaks havoc on your glucose control. Your doctor might have emphasized drinking more water, but they likely missed the critical details of timing and type that we will cover here. Before we begin, a critical disclaimer. The information I'm sharing today is strictly for educational purposes and should not be considered medical advice. I am not your personal physician and cannot provide individualized medical guidance through this video. 1. The first thing protocol. The very first action you should take upon waking is to drink a large glass of water before you consume any coffee, tea, or food. This simple habit is the most effective way to combat the natural dehydration that occurs during sleep and to help flush out the excess sugar that your liver may have released overnight. During the 6 to 8 hours you are asleep, you are not taking in any fluids, yet your body continues to lose water through breathing and perspiration, which inevitably leads to a higher concentration of glucose in the bloodstream by morning. When the blood volume decreases due to this lack of fluid, the sugar remaining in the system is dissolved in less liquid, resulting in a higher reading on your glucometer even if you haven't eaten anything. This is a purely mechanical issue of concentration versus dilution, and it is one of the easiest variables to control immediately. By hydrating immediately, you increase your blood volume, which effectively dilutes the concentration of glucose and helps your kidneys filter out excess sugar more efficiently. This is particularly important for seniors because kidney function naturally declines with age, and the kidneys require adequate fluid volume to perform their filtration duties effectively. If you start your day dehydrated, your kidneys struggle to remove the glucose, keeping your levels elevated for longer periods. Furthermore, thick, viscous blood moves more sluggishly through your circulatory system, which can impair the delivery of oxygen to your extremities, a critical concern for diabetics who need to protect their feet and eyes from circulation damage. Establishing this morning routine primes your metabolism and signals to your body that it has the resources needed to function optimally throughout the day. I recall a patient named Martha, a 68-year-old woman who struggled with what is known as the dawn phenomenon, where blood sugar spikes in the early morning. She would wake up, have a cup of strong coffee, and then wait 2 hours before eating breakfast, often feeling jittery and sluggish. Her mistake was assuming that coffee counted as hydration, when in fact the caffeine acted as a mild diuretic, furthering her dehydration. We corrected this by having her place a full glass of water on her nightstand to drink immediately upon sitting up in bed. Within 2 weeks, she reported that her morning fog had lifted significantly, and her pre-breakfast readings dropped by an average of 15 points. She realized that what she thought was a stubborn metabolic issue was partly a simple fluid management problem. For the senior body, the sensation of thirst is often blunted, meaning you physically do not feel thirsty even when your body is desperate for water. You cannot rely on your brain to tell you when to drink in the morning. You must make it a mechanical habit, much like brushing your teeth or taking medication. When you drink water on an empty stomach, it passes quickly into the intestines and is absorbed rapidly into the bloodstream, providing near-instant rehydration to your organs and tissues. This rapid absorption helps to wake up the gastrointestinal tract, preparing it for the food you will eat later, rather than shocking it with a heavy meal while it is still dry and sluggish. It sets a tone of metabolic efficiency for the rest of the day. To implement this correctly, prepare a 10 to 12 ounce glass of water the night before and place it on your bedside table or right next to your bathroom sink. Aim to drink the entire glass within the first 10 minutes of waking up, ideally while you are sitting on the edge of the bed or just after using the restroom. It does not need to be ice cold. In fact, room temperature water is often easier to drink in larger quantities and is gentler on an empty stomach. If you take medications that require food, you can still drink the majority of the water first, wait 15 minutes, and then have your breakfast with your medication. The goal is to ensure that water hits your stomach before anything else does. 2. The 30-minute pre-meal rule. You should drink a specific volume of water, roughly 16 ounces or 2 cups, exactly 30 minutes before you sit down to eat your main meals. This strategy serves a dual purpose. It physically fills the stomach to induce a sense of satiety, preventing overeating, and it prepares the digestive tract to handle the incoming glucose load more effectively. As we age, our digestion slows down, and the signals between the stomach and the brain that indicate fullness can become delayed. By the time your brain registers that you have eaten enough, you may have already consumed significantly more carbohydrates than your body can handle, leading to a massive post-meal blood sugar spike. Preloading with water helps to bridge this gap by activating the stretch receptors in the stomach lining early. Research has indicated that drinking water before a meal can lead to greater weight loss and better glucose control in older adults compared to those who do not. This is not magic. It is simply leveraging the body's anatomy. When the stomach is partially filled with non-caloric fluid, you naturally feel less ravenous when the food arrives, allowing you to eat more slowly and make more conscious choices about your portion sizes. Furthermore, adequate hydration is required for the production of bicarbonate, which neutralizes stomach acid in the small intestine, and for the production of the protective mucus lining of the gut. If you eat a dry meal in a dehydrated state, digestion becomes difficult, and the body may dump sugar into the bloodstream erratically as it struggles to process the food. I remember a patient named James, age 74, who had a habit of eating very large dinners because he often skipped lunch or ate very lightly during the day. He would sit down and consume a large plate of pasta or potatoes, causing his blood sugar to soar into the 200s before bed. His mistake was relying on willpower to stop eating, which rarely works when hunger hormones are high. We implemented the 30-minute rule, having him set a timer on his watch for half an hour before dinner to drink 2 glasses of water. He found that when dinner time came, he was content with a portion half the size of his usual serving. Over 3 months, he lost 12 pounds, and his evening blood sugar spikes flattened out significantly because he was simply introducing less substrate for his body to process. There is a common misconception that drinking water before meals dilutes stomach acid and ruins digestion, but this is largely a myth, especially when the water is consumed 30 minutes prior. Water passes through the stomach relatively quickly, usually within 20 minutes, so by the time you start eating, the liquid has mostly moved into the small intestine, leaving your stomach hydrated but ready to produce acid for digestion. In fact, the body needs water to produce the hydrochloric acid required to break down proteins and extract nutrients. Without enough water, your digestion can become sluggish, leading to bloating, constipation, and an uneven release of glucose into the bloodstream. To do this properly, you must look at the clock and be precise with your timing. If you plan to eat lunch at 12:30 p.m., you should drink your water between 12:12 p.m. and 12:10 p.m. It creates a necessary buffer zone. Do not chug the water down in seconds, as this can cause you to swallow air and feel uncomfortably bloated. Instead, sip it steadily over the course of 5 or 10 minutes. If 16 ounces feels like too much initially, start with 8 ounces and gradually work your way up as your body adjusts to the new volume. Consistency is more important than perfection in the beginning. It is important to note that you should avoid drinking large amounts of water during the meal itself if you suffer from severe acid reflux or GERD. While pre-meal water is beneficial, excessive liquid while chewing can increase the volume in the stomach too much for those with a loose esophageal sphincter, leading to heartburn. The goal is to hydrate before the food arrives, not to wash the food down with liquid. This simple timing adjustment can act as a powerful brake on your appetite and your blood sugar response. This supports lower post-meal glucose spikes. 3. Mineral-rich water choice. You should prioritize drinking water that contains natural minerals like magnesium and calcium, or consider adding a high-quality electrolyte solution if your water source is highly filtered. In our modern quest for purity, many seniors rely on reverse osmosis systems or heavy filtration pitchers that strip water of everything, including the beneficial minerals that help regulate insulin sensitivity. Empty water hydrates you in terms of volume, but it does not replenish the electrolytes that are critical for cellular function. Magnesium, in particular, plays a vital role in how your body manages blood sugar. It acts as a cofactor for the enzymes that help your body process glucose and allows insulin to unlock your cells effectively. When you are deficient in magnesium, which is incredibly common in the senior population due to poor soil quality and medication interactions, your cells become more resistant to insulin. This means your pancreas has to work harder to pump out more insulin to get the same amount of sugar out of your blood. Drinking water that is completely void of minerals can exacerbate this deficiency because as the water passes through your body, it can actually leach minerals from your tissues to balance the electrolyte concentration, which is then excreted in urine. For a diabetic or someone with insulin resistance, ensuring that your water serves as a delivery system for these minerals is a subtle but profound longer-term lever for health. I treated a woman named Alara, 65, who was incredibly health conscious and only drank triple-filtered distilled water because she was afraid of contaminants in the tap water. Despite her healthy lifestyle, she suffered from frequent leg cramps and stubborn blood sugar levels that wouldn't budge. Her mistake was consuming dead water that provided no mineral support for her nervous system or metabolism. We switched her to a mineral-rich spring water and added a pinch of unrefined sea salt to her cooking. The leg cramps disappeared within days, but more importantly, over the next few months, her A1C levels began to trend downward as her magnesium levels normalized, allowing her insulin to work more efficiently. It is also important to consider that many medications commonly prescribed to seniors, such as diuretics for blood pressure, actively deplete magnesium and potassium from the body. If you are taking these medications and drinking demineralized water, you are fighting a losing battle against electrolyte balance. Calcium, often found in hard water, is also important. While we often think of calcium for bones, it is also essential for the proper signaling of insulin secretion from the beta cells in the pancreas. Therefore, hard water, which causes limescale on your faucets, is actually often healthier for your heart and your blood sugar than the perfectly soft water many people prefer. To implement this, check the label of the bottled water you buy or look up the water quality report for your municipality if you drink tap water. You want to see a magnesium content of at least 10 to 20 milligrams per liter if possible. If you use a reverse osmosis filter at home, you absolutely must use remineralization drops or a filter stage that adds minerals back in. Alternatively, you can buy a bottle of liquid ionic magnesium and add a few drops to your water glass twice a day. It is a tasteless and inexpensive way to turn your hydration into a therapeutic tool. 4. The acidic addition. Consider adding 1 tablespoon of apple cider vinegar or lemon juice to your glass of water specifically before eating a meal that contains carbohydrates. This is a targeted same-day lever that uses chemistry to slow down the digestion of starch. The acetic acid found in vinegar and the citric acid in lemon have been shown in various studies to inhibit the function of enzymes like alpha amylase, which are responsible for breaking down complex carbs into sugar in your mouth and stomach. By slowing this enzyme down, the sugar from your food enters your bloodstream at a much slower, more manageable trickle rather than a sudden flood. For seniors, this is particularly relevant because stomach acid production naturally declines with age, a condition known as hypochlorhydria. Low stomach acid can lead to poor protein digestion and an overgrowth of bacteria in the small intestine, which can worsen inflammation and blood sugar control. By adding a small amount of acid to your water, you are not only blunting the blood sugar spike of the coming meal, but you are also assisting your aging stomach in doing its job of breaking down food properly. This can lead to less bloating, better nutrient absorption, and a flatter glucose curve after you eat. I remember a patient named Thomas, age 70, who refused to give up his Sunday pasta dinner with his family, even though it always sent his blood sugar skyrocketing. He felt isolated eating a separate meal from his grandchildren. We compromised by introducing the acidic water habit. Before his pasta, he would drink a glass of water with a tablespoon of apple cider vinegar. While his numbers still rose, the spike was approximately 20% lower than usual, and he didn't experience the post-meal fatigue he was used to. His correction was not depriving himself of joy, but adding a buffer that changed how his body processed that joy. It is important to understand that this is not about changing the pH of your blood. That is a myth, as your body tightly regulates blood pH. This is strictly about the interaction between the acid and the digestive enzymes in the stomach and the rate of gastric emptying. The acid signals the stomach to hold onto the food slightly longer, which matches the slowed insulin response often seen in older adults. It brings the timing of digestion closer to the timing of your insulin release, preventing the mismatch that causes high readings. To do this, mix 1 tablespoon of organic apple cider vinegar or the juice of half a lemon into a large glass of water. It is crucial that you dilute it. Never drink vinegar straight, as it can burn your esophagus. Drink this mixture through a straw if possible to bypass your teeth, as the acid can erode tooth enamel over time if you sip it slowly all day. Think of this as a functional tonic to be consumed quickly about 10 to 15 minutes before your meal. If you find the taste of vinegar too harsh, lemon juice is a milder alternative that offers similar, though slightly less potent, benefits. 5. Temperature and digestion. The temperature of the water you drink matters significantly more than most people realize, particularly for seniors whose digestive systems have naturally slowed down. You should aim to drink warm or room temperature water, especially around meal times, rather than ice-cold water. Cold water can shock the vagus nerve and constrict the blood vessels lining the stomach, which temporarily halts digestion and slows the rate at which your stomach empties its contents into the small intestine. This delayed gastric emptying, often called gastroparesis in diabetic patients, can cause a mismatch between when your insulin is released or injected and when the glucose actually enters your bloodstream, leading to unpredictable lows followed by delayed highs. When you consume ice water, your body must expend energy to warm that fluid up to body temperature before it can be effectively used or absorbed. This energy expenditure diverts blood flow away from the digestive process to the task of thermoregulation, leaving your food sitting in the stomach longer than necessary. For a senior with compromised digestion or lower stomach acid, this stagnation can lead to uncomfortable bloating, fermentation of carbohydrates, and gas. This physical discomfort acts as a stressor on the body, releasing cortisol, which we know raises blood sugar independent of what you ate. By simply changing the temperature, you remove this thermal stress and allow your digestive enzymes to function at their optimal biological temperature of 98.6 degrees Fahrenheit. I treated a patient named Robert, a 72-year-old man who loved drinking large glasses of ice water with his lunch and dinner. He complained constantly of feeling heavy and bloated after eating, even when he ate small, healthy meals. He assumed it was a gluten intolerance or a reaction to specific vegetables. His mistake was freezing his digestion right when it needed to be most active. We switched him to drinking warm water with a slice of ginger or just plain room temperature water. The bloating resolved almost completely within 3 days, and his post-meal glucose readings became more consistent because his stomach was emptying at a predictable rate. It is helpful to think of your digestion like a fire. Pouring ice water on it dampens the heat and slows the burning process. Warm water, conversely, acts as a vasodilator, meaning it widens the blood vessels and improves circulation to the gut. This enhanced blood flow ensures that the hormones responsible for signaling satiety and insulin release are transported efficiently. For seniors who may have stiff arteries or poorer circulation due to years of elevated blood sugar, optimizing blood flow to the stomach is a critical mechanical advantage you can give yourself at every meal. To implement this, simply stop storing your drinking water in the refrigerator. Leave a pitcher on the counter so it is always at room temperature. If you are eating a meal that is particularly high in fats or proteins, consider drinking a small cup of warm water, like a tea without the tea bag, alongside it. Avoid asking for ice at restaurants. Simply request water with no ice. It is a small request that makes a massive difference in how your body processes the meal you are about to enjoy. 6. The dehydration sugar loop. You must understand the dangerous cycle where high blood sugar causes dehydration and dehydration causes higher blood sugar readings. This is the dehydration sugar loop, and breaking it is essential for accurate readings. When your blood sugar exceeds a certain threshold, typically around 180 mg/dL, your kidneys are forced to work overtime to filter out the excess glucose. They cannot do this alone. They must pull water from your tissues to dissolve the sugar and flush it out through urine. This process, called osmotic diuresis, rapidly depletes your body's fluid reserves, leaving your blood thicker and more concentrated. Many seniors see a high number on their glucometer and panic, thinking they need more medication or that their diabetes is progressing. In reality, that number may be artificially inflated simply because the volume of blood has decreased. If you have less fluid in your veins, the concentration of glucose per deciliter of blood will appear higher, even if the total amount of sugar in your body hasn't changed. This is a false positive that leads many people to overcorrect with insulin or medication, driving them into a dangerous low later when they finally rehydrate. Understanding this context changes how you interpret your daily data. I recall a patient named Sarah, age 69, who came to me during a summer heat wave. She was terrified because her usual fasting reading of 110 had jumped to 145 for 3 days straight, despite her eating practically nothing due to the heat. She was ready to double her medication dosage. Her mistake was not accounting for the fluid she was losing through sweat and the fact that she was drinking her usual amount, not an increased amount to match the weather. We did not touch her medication. Instead, I prescribed her a strict schedule of water intake, 8 ounces every 2 hours. By the next morning, her fasting reading was back to 112. The sugar hadn't disappeared. Her blood volume had simply returned to normal, diluting the glucose to its true concentration. This loop is particularly insidious because the thirst mechanism in the brain degrades with age. By the time a senior actually feels thirsty, they are often already 2% to 3% dehydrated, which is significant enough to impair cognitive function and skew blood sugar readings. You cannot wait for the signal. You must preempt it. If you notice your urine is dark yellow or amber, you are already behind the curve. Your goal should be a pale straw color, indicating that your kidneys have ample fluid to flush out toxins and glucose without straining. To manage this reading context loop, you should get in the habit of drinking a glass of water immediately if you ever see an unexpectedly high blood sugar number. Before you panic, before you take extra insulin, and before you call the doctor, drink 12 ounces of water and wait 20 minutes. Test again. You will often find the number drops or stabilizes simply because you have rehydrated the system. This is the safest first response to a high reading because it has 0 side effects and addresses the root physiological cause of the concentration issue. 7. The stop time strategy. You must implement a strict fluid curfew exactly 3 hours before your planned bedtime to protect your sleep quality, which is a massive, often ignored lever for blood sugar control. Nocturia, or the frequent need to urinate at night, is a major disruptor for seniors. Every time you wake up to use the bathroom, your sleep cycle is broken, and your body releases a pulse of cortisol, the stress hormone, to wake you up. Cortisol directly signals the liver to dump stored sugar into the bloodstream to give you energy. Therefore, frequent waking literally causes your blood sugar to rise while you sleep, leading to that stubborn high morning number, dawn phenomenon, that won't go away. Many seniors make the mistake of trying to catch up on their hydration in the evening because they forgot to drink enough during the day. They sit watching TV from 7 p.m. to 10 p.m., sipping on tea or water, and then spend the night getting up 3 or 4 times. This fragmented sleep creates a state of chronic insulin resistance. Even one night of poor sleep can make your body as insulin resistant as a pre-diabetic's the next day. By protecting your sleep, you are protecting your body's ability to handle sugar the next morning. The goal is to be fully hydrated by evening so you can drift through the night without interruption. I worked with a patient named Harold, 76, who believed his prostate was the sole cause of his 5 nightly bathroom trips. He was exhausted, foggy, and his morning sugar was always around 160 milligrams DL. While he did have prostate enlargement, a review of his habits revealed he drank 3 cups of herbal tea between dinner and bed. We implemented the stop time strategy. He finished his last fluid at 7 p.m. for a 10 p.m. bedtime. He was allowed only tiny sips for medication. Within a week, his bathroom trips dropped from 5 to 1. His sleep quality improved drastically, and purely due to the reduction in nighttime cortisol spikes, his morning blood sugar dropped to an average of 130 milligrams DL. This strategy requires you to front-load your hydration. This means drinking the bulk of your water, about 70% of your daily intake, before 3 p.m. As the day winds down, your fluid intake should taper off significantly. By the time the sun goes down, you should only be sipping small amounts if absolutely necessary. This gives your kidneys roughly 3 to 4 hours to process the evening fluids and create urine before you lay down to sleep. You want to empty your bladder completely right before bed, ensuring an empty tank for the duration of the night. To do this successfully, you must be disciplined about the cutoff time. If you go to bed at 10 p.m., the kitchen is closed for liquids at 7 p.m. If you feel dry mouth, you can rinse your mouth with water or suck on a small ice chip, but do not drink a glass. This simple discipline can reduce fall risk by keeping you in bed, improve cognitive function by ensuring deep REM sleep, and lower fasting glucose by keeping stress hormones low overnight. If you know someone over 50 who could benefit from this, share this video and subscribe for more simple health tips.